Times continue to change in Niagara. The Niagara Health System has been under enormous strain with doctors leaving, doctors coming. This week there was a big announcement from the Niagara Health System that there would be a new head of mental health and addictions. We haven't had one in many years. So it's my pleasure to introduce Dr. Edgardo Perez. Doctor, welcome.
Thank you.
Now, you're living in Guelph currently, but you'll be moving here.
I will be moving here very soon,
Yes.
September the 5th.
Mm-hmm.
And then I will be part of the community.
Very good. Now, you've had some exposure already. The health system had sort of the official announcement about your introduction. Now, we have not had a head of psychiatry or mental health or addictions in a long time. When you look at the caseload right now, could you be good enough to explain the depth of the work that you and your colleagues are facing?
Let me begin by telling you that we have quite a lot of programs in Niagara. When I look at the programs that we have programs in addictions, in psychiatry, we have programs for children. It's a matter of how do we coordinate in such a way that the consumer is aware of how to access the system.
Mm-hmm.
Even now when I look at what we do, I will find difficulties, and I'm a mental health professional. So first we have to begin by looking at what we have, and then we have to see how we can put it together to make it easier for the consumer. Our challenges are challenges that many other communities are facing. It's difficult to recruit psychiatrists, even in Guelph.
Mm-hmm.
With the Homewood, we have difficulties with that. And then we have to look at different ways of delivering care. The same way that we have nurses who are doing anesthesia, we could have nurses and other professionals could really work in mental health, and we do have that. So I do hope that a combination of psychiatrists and other professionals will be able to continue to deliver very good service in Niagara. Accessibility is an issue, but again, not every patient needs to be seen by a psychiatrist. And we have to help the community, help our medical colleagues, that other professionals could help the individual, as long as we have the expertise of psychiatrists at the point in time when we need it. So the challenge for us will be, firstly, to do better integration, better coordination. Secondly, to really build up a system that we can attract really good people. As you know, we are now a true university community with regard to medicine. We have a campus here, so we have to ensure that the people that we attract here, they could also be teachers in a medical school. And at the same time, hopefully through the medical school, we can also recruit people who could be part of the community and practice community psychiatry.
Now, when you speak about coordination, that rings in the minds of many people in Niagara. There are many people in this region who believe for decades our mental health services were working in different ways that no one understood, and we need that coordination for sure.
Yes.
The other challenge that I'm sure you're aware of is our 12 municipalities. We have had tremendous anger towards the Niagara Health System, particularly from the southern tier of the region, Port Colborne, Fort Erie. So you have a job now to try to recover some of that goodwill. Now, we haven't seen that much of that anger recently. But I want to get back to this depth of mental health and addiction issues in Niagara. Can you, as a mental health professional, can you help the audience understand why we have to care about this?
I think that we have to care about that. Let's begin with children and adolescents. We, as others in Canada and Ontario internationally, are having difficulties managing our children, mental health issues. They are the future. So we have to ensure that we develop the resources to be able to take care of them. I'm really pleased that we have a foundation of outpatient resources, and we are going to have also beds for acute care psychiatry for children and adolescents. So that's a plus for us. I'm really pleased with that, because accessing those inpatient services is very difficult, and ideally they should be separate from adults. Also, we are also working in conjunction with other jurisdictions. The connection with Hamilton is working really well for child and adolescent inpatient psychiatry. Recruiting child psychiatrists is not easy, but we have 2 already. So I have been talking to them, and one of them is going to be the lead to reorganize children's services so that we can really use their expertise to the maximum through the input of other professionals in the team. So I'm very optimistic about that. Are we going to take care of all the problems? Not right away. Are we going to work with the school? Yes. I was very impressed reviewing a document about the schools, because in the school system now we have nurses and other professionals working with the teachers. I know that it's difficult. In Guelph, they used to come to us all the time. What can we do with the children? We're having difficulties. So that whole area is an area that we have to further develop. I'm very sensitive to the more rural areas. I have been working with Newfoundland the last year. So I was sensitive before, and I'm more sensitive now. Mm-hmm. And what I really like in Newfoundland, even in this very small community, there were services. Reaching out.
Let me deal with the issue of poverty. In the Globe and Mail recently, there was a wonderful analysis of how a child could go from early years mm-hmm. and end up in prison. That's also mental health. Mm-hmm. What we can't, and I'm not sure that even you can do this, yeah. is we need to find a way to get into the home to help the parent understand the importance of this.
Yeah.
Is there anything that the Niagara Health System can do in that regard?
That's what we call more prevention. And the difficulties in healthcare has been that we are very interested in treatment, but I really believe that we have to get more into prevention. We have to get into what you are describing now. How do we help families to cope more effectively and to be able to be better parents? Yesterday I had a good discussion with one of our community partners. Really, what is essential is not so much health services, is how do we deal with the social issues. Mm-hmm. The social issues are the determinant of health. Mm-hmm. So we in the healthcare system emphasize curing and care, but I think that we have to also begin to be more involved and do more advocacy for what I call the social issues of the community. As you said, poverty leads to social issues, leads to mental illness, leads to higher indices of crime, and a lot of juvenile delinquency and other problems. So part of our role in our system is to do advocacy with the social system. And that's what I mentioned the other day in the press conference, that in psychiatry now we have to be more than treatment. I'm really pleased that I have a background in public health, so I'm really keen in that, because throughout my life I have seen that building communities is what really makes a difference.
Let me put this to you, Doctor. In the recent terrible shootings in Toronto, and then the shootings in Colorado, mm-hmm. in the movie theater, I felt, and please respond if you're willing, I felt that the systems we have in place are not working. When people say we need to work with youth, well, for crying out loud, we've been working with youth, something is wrong.
So the question is, what can we do in helping adolescents cope more effectively? I'm going back to the experience recently in Newfoundland. They were developing programs, recreational and social programs for adolescents, engagement. They were not health programs. Mm-hmm. They were programs related to engagement, social engagement, education in such a way that was fun for them, and you were building a community of adolescents. I think that we need to do more of that. Mm-hmm. That's what I call the social fabric of a community. And again, in healthcare, we think of treatment, but we have to have a more of a public health mentality and work with social agencies to do more of that. I feel that we have to do more of that in Canada, and we have to put more resources in that. Mm-hmm. So part of my role has been, throughout the last many years, is trying to do advocacy at that level, not just at the treatment level. Mm-hmm. At the treatment level, it's hard to do it. Let's do it before.
Now, you have spoken about the need to have more physicians come to Niagara, particularly in mental health areas. Yeah. You probably know this. We have had doctors, medical professional doctors in this region, who say to other doctors, don't come to Niagara. That was a measure of the bitterness of the past. Yeah. Have you sensed that here?
Some of the physicians who have been here, they have mentioned that. But you know, the younger generation are looking at other things. They're looking at style of work.
Yes.
It's very competitive. They are being paid really well.
Yeah.
So we are really, it's a very competitive world out there, and they are very demanding. They ask you what they want and what they want to do, and they want to be paid so many dollars. And we don't have a lot of resources to do that. But I'm optimistic that if we create a good quality work life, and it's a good community, people will come.
Very good.
Especially a new facility.
Very good.
Yeah.
Well, we'll have you back. This is a real opportunity for the region with your introduction here. Welcome to Niagara.
Thank you so much.
If we can help in any way, let us know.
Thank you for inviting me here today, and we will
My
be
pleasure.
in touch.
Thank you very much. So we've got a new chapter in mental health, and we've been lacking that for 6-7 years. I'm glad you watched. Hang on, send me an email. I'd love to get your ideas, and I'll see you very soon.